Hello everyone, my name is Dr. Camille Compton and today we'll be talking about HIV and AIDS. This disease is one that is highly stigmatized in society, unfortunately. What we can do as people is to educate others and also bring awareness to the serious nature of this disease. But in order to do so, we need to understand a few things. We need to understand how do we get it, how to manage it, how to prevent it, and also how to diagnose it. The first question we ask ourselves is, what is AIDS? So AIDS is an infection that is primarily characterized by weakening the immune system of humans and making us more prone to contracting life-threatening disorders or diseases. So where did this virus come from? So many researchers believe that HIV crossed over from infected monkeys when hunters became exposed to their blood. Further studies show that there's a similar virus within monkeys called SIV that is very similar and closely related to HIV. Unfortunately for us, this virus is responsible for the global AIDS pandemic. The first few cases of AIDS in 1981 were discovered in the US. In 1983, almost 2 years later, they finally discovered the cause of AIDS, which was HIV. Once someone is infected with HIV, they go through several stages of the disease. The initial phase is characterized by flu-like symptoms, like fever, headache, sore throat, weight loss, and this usually happens between week 2 and week 6. After a while, they then progress on to the latency period or the incubation period, and this is characterized by fewer symptoms, primarily painless lymph nodes in the neck, armpits, everywhere. And this can last up to 10 years before it eventually develops into early symptomatic phase. And this phase is characterized by chronic diarrhea, herpes, recurrent vaginal candidiasis, oral thrush, and also patients may have abnormal pap smear. Then we move on to full-blown AIDS. So usually someone has normal bacteria, normal flora, and we usually do not get an infection or it doesn't cause an infection in us. But it's to the point where our immune system is weakened that our own bacteria starts producing diseases and infections. Some well-known AIDS-defining diseases include pulmonary TB, recurrent bacterial pneumonia, and also invasive cervical cancer. So what do we want to know next? We want to know, how do we get this disease? So HIV, this virus cannot survive outside of the human cell. So in order for you to get it, it must be transmitted directly from person to person, usually through bodily fluids such as blood, semen, vaginal secretion, or breast milk. Some scenarios that this occurs in is childbirth, blood transfusion, and organ transplants. In this case, it's usually because the blood or the organs are not properly screened for diseases, and then they get transferred to other patients. Injection equipment, like IV drug users, or probably needle stick injuries. And last but not least, the most common way to get HIV is sexual contact. There are a few misconceptions or myths about what type of sexual contact to engage in order for you to get HIV or to not get HIV. I'm just going to clarify a few. So the first one being men that engage in sex with other men are 5 times more likely to get HIV through anal sex. And this is because the skin in that region, the anal region, also the vaginal region, are more likely to have breaks and bleed, and therefore more likely to contract HIV. Second point being, women are 8 times more likely to get HIV from HIV positive men as opposed to the opposite way around. And this again is because the vaginal wall is just more prone to breaks and bleeding, whereas the skin of the penis is not easily damaged. And finally, the female contact and also oral sex, although very rare, it's quite possible to still contract HIV. What would we like to know next? So who gets it? Unfortunately, there are a couple groups that are more prone to getting diseases based on their behavior. For example, homosexuals, the incarcerated persons, sex workers, and homeless people. And what they all have in common is that they engage in high-risk sexual behavior. And there are several factors that influence this behavior, some of them being chronic mental illness, substance abuse, or in the case of sex workers, this is their job, so they are required to have multiple sex partners. So how do you diagnose this? We mentioned that, yes, although there are very obvious clinical signs and symptoms, these signs and symptoms are also seen with other conditions. So to further narrow it down, we do a blood test. And this blood test is called, first one is ELISA test, which is used to detect the HIV infection. And then we do the Western blot test, which is used to confirm the diagnosis. So it's simple, just a blood test, blood, we test in the lab, and then you get your results. So what many would like to know is how to prevent it. And this is very important. Before engaging in sexual activity with your partner, you and your partner should go get tested for STDs. Not only HIV, but all STDs, because other STDs increases your chances of contracting HIV in the long run. Secondly, engaging in less risky sex behavior. This includes just simple things, use a condom, and also just limit the amount of partners, the number of partners you engage in sexual activity with. Secondly, do not inject drugs. We understand there's some substance abusers, so with that being said, at least sterilize the drugs before using or before sharing with others. That will also decrease your risk of getting HIV. And finally, pre-exposure prophylaxis. This was developed for patients or people engaging in sexual behavior with known HIV positive people. So you will talk to your doctor, they give you the medication, and you take it daily while engaging with your partner that is HIV positive. So there's a few cases that I want to discuss, some scenarios that may come up, and you may want to know how do you handle it or what do you do? Or just some facts on what happens in these scenarios. So the first case being, I am an HIV positive person, but my partner is HIV negative. How can I protect myself? How can I protect my partner from HIV? And this is very simple. It requires you as an HIV positive person to take your medication. By taking your medication, you decrease your viral load, making it low or just undetectable. And what this means is that the chances of you transferring the virus to someone else is very, very rare. So take your medication, simple. Second case is I'm an HIV negative person, but my partner is HIV positive. How can I protect myself from HIV? So you being HIV negative, knowing that you're engaging with someone that's HIV positive is very simple, as I mentioned. You can go talk to your doctor, let them know this information, and they will provide you with pre-prophylactic medication, exposure medication, to take on a daily basis while engaging with your partner. And this, then again, decreases your chances even further of contracting HIV from your partner. Thirdly, I am a nurse and I was accidentally exposed to HIV in the workplace. What do? So usually in hospitals and clinics in these settings, there are a protocol that should be followed when needle stick injuries occur. And in this case, they usually recommend that you get treatment within 3 days of being exposed, and then continue the treatment for at least 28 days after to ensure there's no transmission. And lastly, you're a pregnant HIV positive woman, and you would like to know how to prevent mother-to-child transmission of HIV. And this is very simple. This has been around for a while. What they do allow now is the mother to continue on her medication, her HIV medication. And when the child is born, after the 4 to 6 weeks, they also give that child prophylaxis. And there's very, very rare cases where transmission occurs when the right protocols are followed, both the mother get the medication, both the child get the medication. The chances are almost impossible to transfer HIV. So although there is no cure, sadly, HIV is a very manageable and treatable disease with the medications that we offer today, and you can live a very healthy, long, and productive life. So these are my references. I thank you so much for listening. I hope this was very informative and that you learned a little bit more about HIV and AIDS today, and hopefully you were able to bring more awareness and help destigmatize the disease. Thank you so much.